Hello, my name is Buffy Heater. I am the Chief Data and Public Policy Officer with the Oklahoma State Department of Health. Today, I would like to take you through a new dashboard feature that the Health Department has recently launched. The Health Department recognizes that members of the public, the media, our elected officials, local communities, their municipality leaders, as well as businesses, all have a desire for information regarding COVID-19 and its impact on our lives. We recognize that the Health Department has a responsibility to provide Oklahoma statistics on COVID-19 and the impact that it has on our state's population. This video today aims to provide an orientation to the recently launched COVID-19 dashboard and give you some awareness as to why it's provided and what information it contains, especially how to view county level data. As we get started, you'll notice here that we were at the landing page, coronavirus.health.ok.gov. Once you hit this COVID-19 main page, you will scroll down and you will see the dashboard's main page. Please note that if you're using a mobile device to view the dashboard, it will be very important to fully scroll through all the page to view all information. On this dashboard main page, you'll notice that there are some Oklahoma-specific summary statistics as of April 21st, which indicate on a day-by-day basis the total number of confirmed cases among Oklahoma residents, the total number of deaths among those confirmed cases, the direction and number of daily changes, as well as a rate of growth from the prior reporting period. I will point out that this dashboard is updated daily to include new information received by the Health Department over the prior 24-hour period. That prior 24-hour period is typically measured as midnight to midnight. The Oklahoma statistics here are compared to our nation's summary in terms of what's going on with the COVID-19 pandemic. Please note that the data shown here are preliminary and subject to change as additional information is obtained by the State Department of Health. Additionally, for small cities and towns, areas with population of less than 100 people have been suppressed. As you scroll down on this dashboard, you will find visualizations of the data. The Health Department tracks information for both COVID-19 cases and deaths. For the figure that you see on your left, this is indicating Oklahoma case status by date of onset. What you see here is that in blue, you see daily tallies of individuals who are active. You have in purple numbers of individuals who are deceased, and you have in the light green the numbers of individuals who are recovered. This graph is indicating for a particular person with a certain date of onset of symptoms. This graph indicates how many of those remain active, how many of those have died, or how many of those have recovered. Remember that an individual is determined recovered if they've experienced 14 days past their onset of symptoms and they are not hospitalized and not deceased. If you look to the figure on your right, you'll see Oklahoma's cumulative cases by the date they were reported. Please note that this graph indicates the running total of the number of cases reported to date. For example, on April 21st, there were a total of 2,807 cases that the Health Department was reporting. Likewise, on that same day, there were 164 deaths, and there were 588 individuals that had ever been hospitalized. Please note that these are cumulative totals. As we watch these data change over time, it would be our hope and expectation that each one of these lines would flatten out and that we would see no daily increases. These lines, however, will never go down because they are a cumulative total. What I will point out in green, these are the numbers of individuals that have recovered, again, as a total count. The health department began calculating the numbers recorded on April 6th. That's why you do not see any data points for points prior to April 6th. As we scroll down on the page, there are additional data visualizations. The figure on the left indicates Oklahoma's total cases by race. I'll point out here for any given race, as you hover over the percentage on the right-hand side, it will highlight or light up that section of the pie chart, as well as if you hover over that section of the pie chart, you will get the actual count of people that are in that race category. Please note that under races, we do have, as of today, 10.62% that are unknown. Those unknown figures are usually due to a patient that does not choose to reveal their race, or for whatever the circumstances surrounding that case are, perhaps that information was not able to be obtained by the health department. In the center, you will see a similar graph on the Oklahoma total cases by age group. Again, similar functionality. If you'll hover over each percentage for the age category, the corresponding section of the pie chart will highlight, as well as being able to look at the total number of cases for that age group if you hover over the chart directly. Lastly, on this page, I'll point out the Oklahoma status by gender. Here you have split by female in gold and by male in blue, the gender of the individuals who have recovered, who are active, and who are deceased. So we scroll down on the page. I know there's a lot of interest in being able to view data by county, being able to view data by city, as well as by zip code. These blue tiles at the bottom are intended to help you navigate to more specific data tables. So for today, we'll start out with viewing the data by county. Once you click on that blue tile, it will take you to the cases by county page. What you see here are 3 different counts. Confirmed cases by county are in gold, deaths by county are in red, and counts of those recovered by county are in green. You'll notice for any of these maps, you are able to hover over a particular county, and if you will left click on that county, it will provide you the county total. So for example, what you're seeing here is that for Comanche County, there was a total of 72 cases. Now notice on the maps, the color shading is indicated the shading is indicated to be able to tell you by the boldness of the color scheme how many cases are occurring in a particular area. As we scroll down and look at the lists of cases by county or deaths or numbers of recovered by county, you'll see here that the list defaults to the counties with the largest proportion of cases. So for example, Oklahoma County is highlighted as the first row. Here you can scroll across and see Oklahoma County's data for cases, deaths, and recovered. However, if you would like to change the view, if you will left click on the patient county, it will give you an alphabetic sort. By changing the direction of the sort, you are able to click on this arrow and it will give you an A to Z sort. If we navigate back out to the main page, similar views are available on a city level as well as a zip code level. So if we click on data by city, you will see the same organization of the cases by city dashboard. Here you have those same maps of confirmed cases by city in gold, deaths by city in red, and recovered by city in green. On these maps, you're able to zoom in if you are interested in a particular city. And again, by clicking on that city, you would be able to see the total number of cases. The data tables that follow have the same features of providing counts per city, as well as your ability to be able to sort alphabetically to look for a specific area. Going back out to the COVID main page, we will also look at data by zip. Again, scrolling into each one of these maps, you are able to look with additional specificity at a certain area. So for example, as we look at Stillwater, we see that there is a southern zip code of 74074 and the corresponding case count for that zip code, and then a northern zip code in Stillwater of 74075 and the corresponding case count for that zip code. In similar fashion, if you look at the data tables down below, they are listed by those areas with the largest number of cases. However, if you wanted to sort on a numeric basis, you're also able to do that by clicking on that row that says patient zip. Going back out to the main page, we have 3 additional tiles: viewing data for confirmed cases, for deaths, and for recoveries. This is just a different organization of the data. If you were wanting to look only at confirmed cases, but looking across all 3 geographic areas for cases by county, cases by city, and cases by zip, you could click on that blue tile and it would bring you to this visualization. Notice that these are all cases. All maps are shown in gold, so this is case level information only, but now you have it displayed in 3 different geographic levels. As I mentioned, it is important to make sure that you're fully using the scroll function on this page, especially in a mobile environment, using a cellular device. Using that scroll capability is your one way to be able to get down to these blue tiles, which give you the ease of viewing data by county, which we at the health department have recognized that that is a primary source of questions on how to be able to access that county level data. We thank you for your time today. Stay safe.